Hi, we've been asked if you can see routine asymptomatic patients. And the answer is, provided you have space to see them and you're not seeing them at the expense of any other patients who are having problems, then yes, it's fine to see them.
So the question is, does the triage need to be performed by an optometrist? Well, it depends what you mean by the triage. If triage is to ascertain whether the patient has symptoms or their household have symptoms of COVID, or to simply ascertain whether they have a essential or urgent need or not, then that is something that could be delegated to another member of staff. If the triage is that initial consultation that we refer to, like a remote consultation, or part of the case history and symptoms in order to streamline the consultation, then that is something that would need to be done by a GAC registrant, by the optometrist, because that can then count as part of the site test and means it doesn't need to be duplicated within the site test. All remote consultations also need to be completed by a GAC registrant. So that may be for spectral supply, for contact lens supply, or doing a remote review if needed. Okay, next question is, what's the case with visual fields? In the amber period of the recovery guidance, we recommend that visual fields should only be performed when they're clinically indicated. So not for case findings or routine screening, but just when they're clinically indicated, or for when you have a patient who you believe on an individual level they're at a high risk. So what do we mean by clinically indicated? Well, that may mean someone with unexplained headaches, with optic nerve head pathology, or someone where you think there's been clearly a change at the optic nerve head or a development of a retinal nerve fibre defect, and you want to prove or disprove the presence of glaucoma or neurological pathology. With risk stratification, you may choose to do a visual fields test if, let's say, someone has a number of risk factors. For example, they have a very narrow angle, they have very high pressures, they have two parents who have gone blind through glaucoma. There's so many permutations and combinations, there's no one size fits all answer. But if you feel the patient is at a high risk, so not just a routine screening test, but high risk, then that would be an indication to perform a visual fields test. However, if you do perform visual fields tests, you need to use an instrument that can be disinfected, and you need to follow the manufacturer's instructions as to how to disinfect the instrument. Some instruments can be easily disinfected, like tablet-based visual fields or the eyepiece type visual fields. However, bowl perimeters can be very easily damaged by cleaning the inside of the bowl. So you need to be really, really careful to follow the manufacturer's instructions, because if you don't, they will charge you an awful lot of money to fix it. We're currently working with Royal College of Ophthalmologists and Public Health England to see if we can come up with some guidance or some method of managing bowl perimeters which is less laborious than the manufacturer's recommended method. So watch this space, and we'll send out an email when that's been updated.
Well, in our view, it's best to postpone this until the green period if you can. And the reason for that is because although it's okay to see asymptomatic patients if you have capacity to do so, you're going to be spending longer fitting a contact lens patient than you would do just doing a sight test or an eye examination. So we recommend that you don't do that at the moment. However, if a patient needs to wear contact lenses so that they can wear PPE, so for example, if their specs get in the way, or if they steam up, if they need to wear a mask or a face covering at work, then actually it's fine to fit them with contact lenses, even in the red period, but certainly in the amber period, yes. We've been asked if you should do volk as well as using a fundus photograph, or if just using a fundus photograph is okay for an internal examination. Well, in our view, you should do both, because you get information with a volk lens that you can't get with the fundus photograph, such as looking at the ocular media. Well, the answer is, although we now say it is okay to do NCT, and please look at our guidance for information on how you can keep that as safe as possible, we don't recommend that these tests are done routinely. You should carefully think about all the patient's clinical circumstances in deciding whether the test is necessary, and actually it might be better to postpone it until the social distancing measures are over. Having said that, if it is clinically necessary, of course it's important to do tonometry.
Had a question on referrals and more specifically cataract referrals. So about 3 or 4 weeks ago, Sir Simon Stevens wrote to secondary care providers and said that where it is safe, they may now start offering routine procedures such as cataract surgery. Now you're seeing more patients in practice for face-to-face appointments. If anyone requires referring, you should refer them as you normally would. The secondary care provider will then triage those patients appropriately. Don't sit on referrals, don't put people off, just refer them as you normally would, and secondary care will prioritise those most in need. But same as always, you shouldn't refer people unless there is a clear clinical need for them being referred, and you shouldn't be referring people earlier than you normally would in anticipation that the waiting lists are going to get longer. So act as you normally would and put the patient's best interest first when making those joint referral decisions.
Well, the answer is really it depends on the individual circumstances, and this is something you should discuss with the patient. If the patient is having concerns about their eyes, then obviously you should see them, provided you've taken all the steps to make your practice as safe as possible. But if a patient is in an at-risk group of developing COVID or severe COVID-19, then if they're not having any problems, it's probably best to wait until the social distancing measures have been relaxed.
Had a question come in from a member who is in practice, but they're also pregnant. We don't issue advice specifically on this because it's not our area of expertise, but we've been referring members to advice published by the Royal College of Obstetricians and Gynecologists. They've got 2 different documents on their website. One, a really thorough evidence-based review, which is a really interesting read. It's got all the latest information about the risks, concerns, and what you can do to mitigate them. And they've produced a really helpful document with the Faculty of Occupational Medicine, the Royal College of Midwives, called Occupational Health Advice for Employers and Pregnant Women During the COVID-19 Pandemic. And that's a really helpful report. I'd recommend you read that. We've got a link to it on our website. And finally, if you do have concerns, you should speak to your HR team for the company you work for, if you're self-employed, to look at the advice on the .gov website. In our recovery phase guidance, we do recommend that when patients enter the practice, they should be screened for symptoms of coronavirus. So you should ask whether they or anyone in their household has a continuous cough, a raised temperature, or a change of or loss in taste or smell. We don't recommend the use of infrared thermometers because they're not the most reliable instruments. They may give you false readings and they may provide a false level of reassurance or security. It's not to stop you from using them, but they're not contained in our guidance. It's also important to remember that even with that screening in place, it will not detect people with asymptomatic presentations of COVID-19, which we think there may be quite a number of people in general circulation who may have coronavirus, and that's why it's really important that even with that screening in place, that you still maintain adequate infection control procedures, wear the PPE when required, and make suitable changes to what you're offering and be focused on a needs-led approach while you're seeing patients for face-to-face appointments. So next question that's coming is, do you need to wear a face mask and gloves for the whole consultation, or can you get away with just wearing them for the short bit when you're performing volk or when you're having actual touching the patient? The answer is, in Public Health England's advice relating to direct patient care, you should be wearing the mask, the apron and the gloves whenever you're providing that direct patient care, and really that is the whole time whilst you are in the consulting room with the patient, not just for the bits when you're very close.
We've been asked about the 15-minute rule and how that applies to optometric practice. Well, there's no hard and fast rule, but you should try and limit the amount of time that you spend with the patient in the enclosed environment of the consulting room whilst we're in this phase of the pandemic. And that means rather than doing blanket tests on all patients in a particular category, such as fields and pressures on everyone over 40, for example, you should think about whether they're actually needed for this particular patient. If you decide not to do a particular test that you would otherwise have done as part of your routine, make sure you carefully note that on the record and explain to the patient why it is safe for you to postpone doing that test until the social distancing measures have been relaxed. And remember, it's not that you're never going to do that test again, it's just that you're not doing it this time and it is safe to actually postpone it.